Well, thank you to the AIS committee for inviting me here today. I am delighted to have the opportunity to share with you one of the best kept secrets in the booming category of scalp care. I invite you to think about a new way to approach one of the biggest confidence boosters there is, great hair. Well, in our pursuit of great hair, we rub, smear, illuminate, massage, coat, brush, and inject various things onto our scalp and into our strands. And by that I mean chemicals, botanicals, nutrients, proteins, energy, blood products, and we also ingest drugs, vitamins, and nutrients to change the biochemistry through vascular delivery around the follicle. But what about the scalp? That living, breathing ecosystem. Most of us pay little to no attention to the scalp, but we still hope to get ad-worthy hair. So let me show you a picture. This is a close-up view of a scalp. Now, this particular scalp belongs to a hairstylist who was convinced that she was using the best products with the best possible regimen. This is her scalp after one treatment with our product Keravive. Now, if you were a follicle, which scalp would you want to live in? And I ask you, how can we possibly have Fifth Avenue hair with a Skid Row scalp? We all know that the hair that we see is dead keratin. The activity happens in the follicle embedded in the scalp, where there's a symbiosis between stem cells, epithelial cells, keratin, and sebum. And the benefits of healthy hair growing from a healthy scalp are just starting to become more broadly realized. And it was that realization that led us at Hydrofacial to launch a new treatment in the new category of scalp hair health. Quick poll, has anybody in the audience ever tried a Hydrofacial? If you have, you can just blink. Yeah, okay, quite a few. That's good. If I wanted to take a few minutes to tell you why we think now Keravive is the next big thing in beauty. These photos show what it's like to get a treatment, a Keravive treatment. It's actually relaxing. It feels good. And the woman on the left, by the way, is the scalp that you saw in the earlier pictures. The foundational concept for a Keravive treatment is similar to Hydrofacial, except here we cleanse, peel, extract, hydrate, fuse, and protect the scalp in order to optimize the follicular environment and encourage healthy growth of keratin. The vortex tip and vibration help to stimulate a healthier, thicker dermis, while salicylic acid and the suction action remove the follicular debris that creates a clear channel for delivery of the Keravive growth factor solution. The growth factors themselves are encased in nanolipid particles for trophic delivery to the base of the follicle where the stem cells reside. And the Keravive solution was developed by an entrepreneurial scientist who was losing his own hair. And he teamed up with dermatologist Dr. Amy Taub and then spent 6 years developing this patented technology. The biomimetic growth factors in Keravive are chosen and optimized in concentration and balance to replace the key ones missing in a deficient scalp. Each one of the 7 synthetic proteins mimics a growth factor that plays a role in vascularization, keratin secretion, cell growth and proliferation, reduction of oxidative stress, and regulation of the hair cycle. They are individually synthesized in wraps so that they're individually absorbed. And during the Keravive treatment, the growth factors are infused through our handpiece with the vortex tip, and then the consumer or patient then goes home with the topical spray for daily infusion of those same growth factors, along with the conditioning agents like arginine, niacinamide, and panthenol 5. Now, I used the words consumer and patient because Keravive is a complementary treatment, whether it's a consumer trying non-invasive approaches or a surgical patient. Because let's face it, most people are interested in a healthy scalp because they want better hair, and that often requires a multifactorial approach. In fact, we've heard from some of the hair transplant surgeons that use our product that they'll use Keravive before surgery to optimize the follicles that will be transplanted, and then after surgery to maximize viability of the transplanted follicles. I'd like to show you some results from a multi-center clinical trial that we conducted in which patients had 3 Keravive treatments, each spaced 1 month apart. The subject responses were highly positive. The investigators also noted that hair was healthier and shinier in 82%, with improvement in the appearance of temporal recession and the appearance of hair loss at the crown. 64% of subjects felt hair loss decreased as a result of treatment. 56% reported improvement in the evenness of their hair, and subjects also experienced symptomatic relief in dryness, itchiness, and flakiness in 40%, 43%, and 50% respectively, following a single treatment. We launched Keravive in January of 2020, which is not great timing, but it's results like these posted on consumer social media accounts that have sustained Keravive these past 2 years. And here's one more real-world example that fuels our optimism for Keravive. But we're also excited about the future because we think we're sitting on a huge, barely tapped opportunity in a market that's rapidly growing. We've been a bit quiet about hair and scalp coming out of the pandemic, but we're getting loud in 2022 because we believe we combine the best of devices and topicals in a painless way that complements everything else the consumer is doing today to address their hair and scalp concerns with an emphasis on prevention and regeneration. I encourage all of you to try a Keravive scalp treatment if you haven't. Your scalp will thank you, and I thank you for your generous attention.